Okay. Welcome to the Fall Open House of 2018. We're starting on our first tour here in Medical Laboratory Sciences. Okay, guys.
Okay, welcome to Medical Lab Science, and we'll start off with microbiology. So, in the first year of microbiology, students learn all about different types of bacteria that are pathogens to human body, and we learn all the technology that's out there to isolate them and identify them. So we learn a lot of theory that goes behind the techniques and the bacteria morphology. And then in second year, we build up on the theory and learn more practical side and the applications of them. And we use the simulated body systems, and the bacteria are isolated from them, and students learn how to ID them and learn about what kind of antibiotics to use to potentially cure the patient. So leading up to the simulation clinics that are right after second year, we get a first-hand simulated lab experience, and we kind of build on our professionalism and how the real lab works out there. So it's kind of a preparation that is required before we move on to clinical placements that happen right after summer simulations. So if you look here for the open house, we have...
Let's move right in here, Lakshi.
So if you look here, we have different stations to kind of give an idea of what first year and second year look like. We have the PCR samples and the results, and we have a microscope set up for gram staining, and in addition to gram staining, we have cultures there that gives idea of what kind of technology is out there and how bacteria looks like on the plates. And then finally, in addition to bacteria, we use parasites and fungus studies. So that's also another component of microbiology that is done in first and second year. So that's one of the programs. The next program is chemistry, and Shashia will lead on to that.
So over here we have where we do our urine analysis. We have these small instruments like the Clinitech. We also have our osmometer over here. Which uses freezing point osmometry, which is really cool. So that's for chemistry. We're going to move on to transfusion.
Okay.
Hello, so this is transfusion setup here. We have a bunch of different things that we go through. We have our main machines that we have used so far in our programs. Usually we start off really simply. We learn the tube method, which is the very basic. A lot of things are automated now. So we do have the tube method where we can do a lot of our testing via a tube with a blood product and something like anti-sera or something else to test that blood. Or we can also do it the same thing in one of these cards. It's called an MTS card, and that would go in this lovely machine right over here. And it does the same kind of reactions, but it does multiple reactions all at once. And then it's a little easier to read. So you kind of have the two options depending on where you end up. You might have to do tube, you might have to do MTS, but we get to learn both, so we know how to do it. We do have, I don't know if you can see that, but it's an image of kind of different reactions that you might see in a tube. You can see positive, negative, and we would grade the reaction and determine our blood groups if anything was wrong, and this would help a technician in the hospital, a technologist, determine if they were going to give them a transfusion, if they were going into surgery, or if they had some sort of accident. We'd be able to give them a blood product that could help save their life or could help keep their levels up, keep them healthy. And this determines whether or not it's going to be compatible with that person. And then we can also determine if there is some sort of reaction with something that we've given them a blood product. We can determine what it was and avoid it in the future.
Great, thanks. Okay.
Okay. So next discipline is hematology, and I'll bring you over to our first and second year students down here.
Lorinda, can you talk to us about the potential graduate experiences after the program?
Most of our students graduate and get a job within 6 months. So it's not always a permanent full-time job. Sometimes it is a mat leave or part-time, but most of them have a job within 6 months. And some of them, in fact, some of our current students who are still in placement have already got job offers at their clinical placement. So there are lots of people still retiring in our field, so they still say there's going to be a shortage of technologists in Canada. Okay. Edith, would you like to talk about hematology?
Alright, so in hematology, we also work with blood just like transfusion, and we do a complete blood count at first all the time. And whenever there's a problem with the analyzer or there's flags on our reports, we always do a blood film. So here we have different types of disease for blood. So here we have a normal blood. This is how normal blood looks on a blood smear. Right. And if you want to walk down, we have different ones too. So this is a leukemic blood smear, and there's a microscope for people to look at as well. And we have sickle cell right over here. You can see. And the last one we show is of a parasite that can be found in blood. And these are a lot easier to see because they're large and they're always just out front. And that's what we do in hematology.
Awesome.
Okay. So we'll walk over to see the histologies. Histology is the 5th section of our program. We'll walk over just to the next group.
So as students, do you think it'd be possible to have a full or part-time job while in the program?
I think it might be possible to have a part-time job. I think especially if you have classes that end maybe like in the early afternoon, it would facilitate working like in the later evenings. So I think it's possible. But you do definitely have to have time management skills because this program is very intense. It's enjoyable but very intense. Yeah.
So our program actually has labs on the 7th and 10th floor as well, but they're being used by our continuing education department. So we'll see histology in here. So in second year, you start to do histology. Do you want to just let them, this is being filmed live, so if you want to just let them know what we do in histology.
Okay, so the first step would be tissue grossing, which is just farther down there. We get samples from biopsies or surgeries, and the doctors provide us with the tissue. We measure it and evaluate it based on how it appears, and then we cut it into smaller tissue so we can eventually embed it onto a slide so that people can, our pathologists can evaluate the tissue. So we take a part of the overall tissue, we embed it in wax, and then we use one of these micrometers to cut the tissue into very thin segments so that we can embed it onto like a slide here. And then we go through a staining process, and then once the tissues are stained, we can look at them under the microscope, and that's where the pathologist comes in and determines if there's any abnormalities in the tissues.
Cool. So how would you say the program curriculum is delivered, and will I see a difference from how I was taught in my undergrad to how I'm going to be taught at Michener?
So most of our classes include both a theory component and a lab component. There's a couple of courses where it's more just theory only, but most of them you have lectures and followed by labs usually in the same week that will cover what you have just learned in theory. So it's a lot of application based. So as far as is it different from university, what do you think?
Yeah, it's definitely different from university. When I was at U of T, it was way more theory-based and less application of most of our knowledge. Here, it definitely, you apply everything you learn in your lectures, and it's very hands-on, and the material really makes sense once you get the hands-on experience.
And you're enjoying it?
Yes, it's great.
I think you probably spend more time in labs than you do in lectures, actually.
Yes, definitely.
There's more time in labs.
So more time in labs and lectures.
That's good. Okay, so let's go on, and we'll just, some people are demonstrating phlebotomy. So in addition to our 5 main disciplines, we do teach our students to do phlebotomy. Not all technologists will be taking blood when they are out there working, but there are some places where you will, particularly if you're working in a smaller hospital, you may have to learn to take blood. So we start off with simulated arms. So they use all the same equipment that you would in a hospital. but we start with the simulated, and eventually you do start learning to take blood on your peers. So you donate your arm for a peer, and you will take blood from one of your peers, sometimes faculty too. Okay.
Okay. How about clinical placements?
Okay, so we have clinical placements all over Ontario. We do sometimes have placements outside of Ontario depending on what's happening with our clinical sites. The clinical sites do change from time to time, just depending on what's happening at the hospital. Sometimes they're doing some upgrades, getting in new analyzers, or moving completely so they can't take students for a year or two. So that does change. Students can expect to be in either a hospital or a private lab, and most of the time you'll be at least 2 different sites. So you could be at a private lab for a couple of rotations and then at a hospital. And our clinical placement is 20 weeks long.
20 weeks.
Yeah. And you'll be ready to write the exam in February, about 2-3 weeks after you finish the program.
And then, do I have to write any regulatory exams upon completion?
Yes. So there is, once you've completed the program, you've completed your clinical, everything has been successful, you're eligible to write the CSMLS exam, and that will allow you to work anywhere in Canada.
And that's anywhere in Canada?
Anywhere in Canada. So whether you're talking about, we do have actually one person who was up in Yellowknife. We've had students go up to Yukon to work for a while, in northern Manitoba, none of it. So across Canada.
Awesome.
Yeah.
Okay, well, that was our first tour of the day. That was MedLab. We'll be moving on to Cytology. So we'll just be pausing the video between tours. Thanks. Stay tuned.